Snoring can be caused by various factors, such as nasal congestion, obesity, sleep position, alcohol consumption, or structural abnormalities in the airways. The treatment for snoring depends on the underlying cause and severity of the condition. Here are some common approaches to address snoring. Lifestyle changes. Making certain changes in your lifestyle can help alleviate snoring. These include maintaining a healthy weight, avoiding alcohol or sedatives before bedtime, establishing a regular sleep schedule, and sleeping on your side instead of your back. Nasal strips or nasal dilators. These over-the-counter devices can help open up the nasal passages, improving airflow and reducing snoring caused by nasal congestion. Oral appliances, mandibular advancement devices, MADs, or tongue-retaining devices, TRDs, can be used to reposition the jaw or tongue during sleep, preventing airway obstruction and reducing snoring. These devices are typically fitted by a dentist specializing in sleep medicine. Continuous positive airway pressure, CPAP. CPAP machines deliver a constant flow of air through a mask worn over the nose or mouth, keeping the airway open during sleep. CPAP is commonly used for sleep apnea, but it can also help with snoring. Surgery. In cases of severe snoring caused by structural abnormalities, surgical interventions may be considered. It's important to consult with a healthcare professional or a sleep specialist to determine the underlying cause of your snoring and the most appropriate treatment options for your specific situation. They can provide a comprehensive evaluation and recommend the best course of action.